All right, so let's just do a health update for the week, what we're seeing in the clinic, what kind of is happening this week. So basically we have a decrease in flu. We are not seeing quite as many cases, but we are still seeing a few cases, mainly flu A still. That's the H1N1 virus that came through in 2009. So we are seeing the majority of these cases in kids because a lot of them weren't around in 2009, so they've never seen this particular strand before. So we're seeing that, but it is going down, it is trending down. I am seeing some pops of COVID. So we had a pretty mild COVID winter, but now I'm starting to see some little spikes of COVID here. We have diagnosed a couple of people this week and last week, so we are seeing that. Let's talk about the measles outbreak. So I've had a lot of questions about it. Right now for 2025, we've had 301 cases of measles. These have not all been in the outbreak area, which is like the Texas, New Mexico area, but all over the United States. This is probably the largest outbreak that we've seen since 2019. 2019, for the entire year, there was 1,200 cases across the entire country. But what we're seeing right now with the outbreak center, which is like Texas and New Mexico, that area, they've had about 285 cases. 95% of those have been unvaccinated individuals, seeing about a 17% hospitalization rate. So about 17% of those 285 have been hospitalized, and we have seen 2 deaths. Both of those were in children that were unvaccinated. So how do I feel about this? What do I think? So let's talk about the symptoms of measles. 7 to 14 days after you're exposed to measles, you can start running a fever, you can have a cough, runny nose, you're going to start to notice white spots inside of your mouth, and then the rash will start a couple of days after that. It normally starts at the head and works its way down over about 3 days, and then as it goes away, it recedes the same way that it came. What are the biggest worries about measles? Why is it such a big deal? Why is everybody freaking out over a rash? With this, you can get several complications. You can get pneumonia from it, but the biggest one that really causes the most trouble is encephalopathy, and that's swelling of the brain. So when this virus comes in, it can attack the brain, and when it does that, the brain swells, and that swelling can be deadly. Your brain only has so much room in there to go, so when we have swelling inside there, they may have to remove the skull to allow the brain to have room to swell, and even that doesn't work sometimes, and the brain will, what we call, herniate down the brain stem, and that's how people pass away. In 2000, the World Health Association said that measles had been eliminated because of the vaccination rates and just because of herd immunity. So if you're seeing that it's coming back, we are seeing a decrease in vaccination rates. The MMR vaccine is considered safe. It has been around for decades. It uses mild live viruses in order for your body to react to it. So when you are getting this vaccine, you're actually getting some of the virus itself. So when your body sees it, it attacks it, it makes antibodies. So the next time it sees it, it is already prepared to take care of it without complications and without you getting full-blown measles. There have been multiple studies that have been done showing that it is not linked to autism, and it is very safe for individuals to get. It is one of the vaccines that prevents us from measles, mumps, and rubella. Mumps is a virus that can attack the glands in the throat. It can also cause swelling in that area that causes breathing difficulties, and in males it can even go to the testicles, which can cause sterility. Rubella is also one of the viruses that's in this vaccine, and it keeps people from getting rheumatic fever, and you can also have chronic rheumatic fever if you've ever had it as a child. So these are things that can cause chronic problems in the body over a lifetime, and there is an easy, simple way to prevent that, and that is vaccines. Am I for all vaccines? Absolutely not, and I will be the first to tell you that. But there are some vaccines that if it was today, and my children are 18 and 16 now, but if I had a child that it was vaccination age right now, they would be getting the MMR vaccine just to protect them and to protect the people around them that are unable to get the vaccine. Herd immunity is a good thing, and it is something that has proven in the past to keep us as a community safe. All right, guys, that's the health update for this week.